Which of the following is the most significant factor in the prevention of long-term cognitive dysfunction following cardiac surgery with CPB? A. Use of neuroprotective drugs during surgery. B. Avoiding prolonged exposure to CPB. C. Aggressive postoperative anticoagulation therapy. D. Early detection of cognitive decline post-surgery. Answer: B. Avoiding prolonged exposure to CPB. Explanation: avoiding prolonged exposure to cardiopulmonary bypass, CPB, is one of the most important factors in preventing long-term cognitive dysfunction following cardiac surgery. Prolonged CPB can lead to hypoperfusion, embolism, and inflammation, all of which increase the risk of long-term cognitive decline. Neuroprotective drugs and postoperative interventions may help, but minimizing CPB duration is key to reducing cognitive risks. Which of the following is the most commonly used method to prevent cerebral embolism during cardiopulmonary bypass, CPB? A. Use of an aortic filter. B. Administration of antiplatelet therapy. C. Use of hypothermia. D. Preoperative anticoagulation therapy. Answer: A. Use of an aortic filter. Explanation: the most commonly used method to prevent cerebral embolism during cardiopulmonary bypass is the use of an aortic filter. These filters are placed in the aortic arch during surgery to capture any embolic particles that may be released into the bloodstream during CPB, reducing the risk of cerebral ischemia or stroke. While antiplatelet therapy and hypothermia may have some benefits, they are not as directly effective in preventing embolism as the use of aortic filters. Which of the following types of stroke is most commonly seen following cardiac surgery with CPB? A. Hemorrhagic stroke. B. Ischemic stroke. C. Cryptogenic stroke. D. Subdural hematoma. Answer: B. Ischemic stroke. Explanation: ischemic stroke is the most common type of stroke seen following cardiac surgery with cardiopulmonary bypass, CPB. The stroke typically occurs due to embolic events, where clots or air bubbles travel to the brain, blocking blood flow. Hemorrhagic strokes are less common and usually arise from complications such as uncontrolled hypertension or surgical injury. Which of the following is a typical cause of cognitive dysfunction or delirium in the early postoperative period after cardiac surgery? A. Hyperglycemia. B. Sedation and sleep disturbances. C. Hypertension. D. Hypotension. Answer: B. Sedation and sleep disturbances. Explanation: sedation and sleep disturbances are the primary causes of cognitive dysfunction or delirium in the early postoperative period following cardiac surgery. The use of sedatives and the disruption of normal sleep cycles can contribute to confusion, agitation, and delirium. Other factors such as hyperglycemia, hypertension, and hypotension can also influence cognitive function but are typically secondary to sedative effects and sleep disturbances in this context. Which of the following techniques has shown a significant reduction in cerebral injury during cardiac surgery with CPB? A. Use of blood pressure augmentation. B. Continuous monitoring of brain oxygenation. C. Inhaled nitric oxide therapy. D. Use of steroids during surgery. Answer: B. Continuous monitoring of brain oxygenation. Explanation: continuous monitoring of brain oxygenation, using tools such as near-infrared spectroscopy, NIRS, has shown a significant reduction in cerebral injury during cardiac surgery with CPB. By allowing for real-time monitoring, clinicians can detect cerebral hypoxia early and intervene promptly to improve oxygen delivery to the brain. Blood pressure augmentation and the use of nitric oxide or steroids have some roles but are not as effective in preventing cerebral injury as continuous brain oxygenation monitoring. Which of the following is a potential long-term effect of cerebral hypoxia during cardiac surgery with CPB? A. Increased incidence of hypertension. B. Chronic cognitive impairment. C. Decreased lung function. D. Chronic pain syndrome. Answer: B. Chronic cognitive impairment. Explanation: chronic cognitive impairment is a potential long-term effect of cerebral hypoxia during cardiac surgery with CPB. Prolonged periods of low cerebral oxygenation can lead to irreversible brain damage, manifesting as memory problems, difficulty concentrating, and other forms of cognitive dysfunction, often referred to as postoperative cognitive dysfunction, POCD. Other outcomes, such as hypertension or pain syndromes, are less directly related to cerebral hypoxia during surgery. Which of the following factors contributes to an increased risk of postoperative delirium in patients undergoing cardiac surgery with CPB? A. Younger age. B. Pre-existing cognitive impairment. C. Low body mass index, BMI. D. Short duration of surgery. Answer: B. Pre-existing cognitive impairment. Explanation: pre-existing cognitive impairment is one of the strongest predictors of postoperative delirium in patients undergoing cardiac surgery with CPB. Patients with baseline cognitive dysfunction are more vulnerable to delirium following surgery due to factors like anesthesia, sedation, and systemic inflammation. Younger age and a short duration of surgery are less associated with delirium, and low BMI does not have a significant role. What is the most significant intraoperative factor affecting the risk of postoperative cerebral complications during cardiac surgery? A. Duration of anesthesia. B. Duration of cardiopulmonary bypass, CPB. C. Type of surgical procedure performed. D. Use of mechanical ventilation. Answer: B. Duration of cardiopulmonary bypass, CPB. Explanation: the duration of cardiopulmonary bypass, CPB, is the most significant intraoperative factor affecting the risk of postoperative cerebral complications. Prolonged CPB increases the risk of cerebral hypoperfusion, embolism, and inflammation, all of which can contribute to cerebral injury and cognitive dysfunction after surgery. While the type of surgery and anesthesia duration may contribute, CPB duration is the primary risk factor for cerebral complications. Which of the following is an early diagnostic tool for detecting cerebral ischemia in patients undergoing cardiac surgery with CPB? A. CT scan of the brain. B. MRI scan of the brain. C. Transcranial Doppler, TCD, ultrasound. D. Positron emission tomography, PET. Answer: C. Transcranial Doppler, TCD, ultrasound. Explanation: transcranial Doppler, TCD, ultrasound is an early diagnostic tool for detecting cerebral ischemia during cardiac surgery with CPB. TCD can detect changes in blood flow velocity in the cerebral arteries and identify the presence of emboli, allowing for immediate intervention to prevent further cerebral injury. CT and MRI scans are more commonly used postoperatively, while PET is less frequently utilized in this context. Which of the following strategies has been shown to help reduce the risk of cerebral complications in patients undergoing aortic surgery with CPB? A. Use of heparin-coated circuits. B. High-dose aspirin administration preoperatively. C. Increased hypothermic cooling during surgery. D. Administration of intravenous fluids during the procedure. Answer: A. Use of heparin-coated circuits. Explanation: the use of heparin-coated circuits during cardiopulmonary bypass has been shown to reduce the risk of cerebral complications in aortic surgery. These circuits minimize the risk of thrombus formation and embolization, which can lead to stroke or other cerebral complications. Other strategies such as hypothermic cooling or intravenous fluid administration may have some benefits but are not as directly related to preventing cerebral embolism and ischemia as heparin-coated circuits.